Hello, and welcome to the Roselle Center for Healing's informational webinars. I'm your presenter, Dr. Stephanie Pina, naturopathic physician and licensed acupuncturist. I'm here to present Springing Back from Seasonal Allergies, a Natural Approach. It's allergy season again, and so whether we're in the midst of all of our allergy conditions or looking at how do we prevent allergies from the upcoming seasons or what we can do in the meantime, all this information is great to kind of understand why allergies create such a problem in the body. Let's go ahead and get started. So what do we think of when we hear the word allergies? A lot of the times we think of the allergen itself or the different pieces of information tied to allergens. Tree pollen, grasses, ragweed, mold, dust, different types of foods such as peanuts and shellfish, poison ivy that can get on us topically. But we also think of some of the other things that we don't always consider being tested or that we might know of offhand, such as pet dander, insect bites, preservatives in foods, different types of medications, including sulfur drugs, latex, different types of heavy metals and chemicals can all have a different type of allergic reaction that we have to deal with. What we're going to talk about is why we have these types of reactions and why they're so common. We also tend to think a lot about the symptomology. So when I say what happens to you during your allergy reaction, a lot of these symptoms that listed here on this page might be things that you go through, such as stuffy, runny noses, sniffling, sneezing, nasal drainage, and it can also lead to other things such as swelling in the skin, hives, headaches, because basically some of these reactions can't get out of the system and we can't detox them fast enough. Often allergies that involve the respiratory tract can also create issues such as coughing, wheezing, and shortness of breath, and even to the point where we have anaphylactic shock. Typically, you'll see this with different types of food substances because it has a direct contact with the internal body. But what we don't often think of is when people start to become sensitive to a lot of different things. They can't go outside, they can't go inside, and sometimes they have a difficulty even eating food and taking supplements. They seem to be allergic to everything, or they're seeming to develop sensitivities to a number of different things. All of these things relate to our allergy response, and this is the type of thing that we need to learn to correct and we can use naturally to help decrease things like histamine, but also to help decrease the inflammation reaction in the body in general. There are other things we have to think about allergic responses as well too. How do these allergies basically affect other parts of the body? Well, some of the things that we think about that are common with allergies, such as histamine responses, are coming from cells that are basically located in a number of different parts of the body. So while we focus a lot, especially in the springtime, on our nose and our eyes and our head, those same kind of histamine response can take place in the urinary tract, respiratory tract, digestive tract, and also even in the bladder as well too. So essentially we can have these kinds of inflammation responses happening at the same time, even though the allergen might be something that we're breathing in or that we get topically on our skin. Overall, what tends to happen is this can lead to a lot of annoying substance issues such as loose stool and constipation, or even cramping. Nausea and vomiting and reflux can often be confused with digestive issues, and also can be related to allergies as well too, such as sore throat and nasal drainage. We can get increased joint pain, which often can be confused with different types of arthritises or overactive injuries. Our immune system uses very complex ways to basically bring the allergen to the body's attention and to deal with it. But as it does that, it also increases the systemic response. It creates stressors that are way too big for the body to handle over and over again. That increased amount of stress can also lead to more inflammation. And when the body can't handle it, the burden becomes too great. We'll talk about this in just a minute. But these flaring conditions can also be a little bit more challenging for people who are already under immune system issues, such as those diagnosed with autoimmune disease, where their immune system is attacking their own tissues and healthy tissues. They already suffer from things like different types of pain and fatigue, and it takes more energy for the body to heal itself. Often you see allergies and allergy types of medication related to different types of brain fog and even dementia, because the body is still having a harder time to only function physically, but also the brain itself has a hard time creating a barrier between these inflammatory responses. So wouldn't it be great if there was a world without allergens? Well, unfortunately, that's a trade-off as well too, because without any pollens, we wouldn't have any flowers or trees. We'd have to get rid of our pets, and we might not even see any honey anymore if we got rid of the bees and the wasps up there. We might even notice that there's a less variety of food because there's increased food sensitivities due to the use of different chemicals and the lack of nutrients in the soil. Or even our immune response might be different. We may not be able to create a normal immune response to get rid of different types of toxins if we didn't have allergens. So is there something that we can do if we can't live with them or can't live without them? Let's talk about the allergy response and what our body does. Dealing with allergies and any kind of inflammation can be, even when we're trying to heal, can be a normal response. We want the body to be aware that there's something entering the body that we need to get out. So whether it's a pollen or pet dander or a different food that we have an allergy or a sensitivity to, we want to make sure that we have things in place to basically help us remove those allergens as quickly as possible. We have different types of physical barriers, and these start with the mucous membranes that are located in a lot of the places where the allergens can get in, from the eyes, the mouth, and even in the reproductive tract. And so we have these physical barriers like our skin as well that from the outside in are there to kind of help produce different types of mucuses and substances that not only make us more aware that there's something entering the body that shouldn't be there, but also helps us to flush it out. So this is the reason we get the runny eyes and the runny nose, is to basically to flush things out. Our own response is to produce these types of mucus products. But unfortunately, if it keeps happening over a long time, it keeps producing more and more. And it also pulls from our own water supply sources to do this. So essentially, it's an over response that we have to worry about, not the normal response. Part of this is also creating an acute reaction effect. And we have the 5 classical signs of acute reactions and inflammation that help to deal with some of these issues. We see redness, swelling as more fluids move into the tissues. Sometimes there's heat, localized with itching and pain on the skin. Pain itself in the local areas or in other areas, and even loss of function are typical responses of inflammation and also our acute reaction response. The localized tissue, as it gets inflamed as well too, basically draws more chemicals to them to get more blood flow to the local area to help secrete substances that draw more attention to the allergens. And whether or not we know the exposure or not, the body continues to react like this until it feels like it has gotten the allergen or the toxin out of the way. The increased response makes symptoms worse and harder to remove, which also makes it harder to basically not get additional symptoms or for things to keep reacting this way after another exposure. That's why a lot of the times when we treat allergens just from a symptomatic way, often those symptoms come back season after season, or they may come up in a different form. We may move to another part of the country where it may not be an issue at the moment, but we get used to their seasonal allergies as well too, or other types of conditions. Now we see this happen also as we grow older. Sometimes you'll actually see infants who are very colicky and have digestive issues. Often in their childhood, they'll start to develop earaches and eczema on their skin. And even as adults, they may turn into adults with asthma and GI distress problems. We have to think about what leads next. Does that lead to some of the other chronic diseases of inflammation, such as cardiovascular disease, diabetes, and joint pain? All this is based off of a normal response that's basically gone wrong. The normal response to an allergen is essentially once the allergen enters into the body, whether it's the bloodstream or to a tissue, we release mast cells, which are basically white blood cells that have granulars in them. These granulations actually end up releasing histamine, which causes the local responses that we're used to, that we're commonly talked about, and also is the common site of different types of medications in order to block the histamine response. So it's only working on the very localized level. As time goes on, the allergen itself is picked up and brought further into the body and brought along lymphatic systems to the lymph nodes, and also is interacting with different types of white blood cells which are making up our immune system. Those different white blood cells make immunoglobulins, so they're able to recognize the allergen in the future in case we get re-exposed, and we can deal with them a little bit better. This complex system can recognize almost 10 to the 6th number of allergens, and we can make that many immunoglobulins that makes it more than the number of stars in the galaxy. So overall, our immune system is doing a really good job, but it can be stressed out and tired when we have so many other things going on that we have to worry about our health. This type of allergy response is happening whether or not we know it, but definitely the things that we pay attention to is this first step, the histamine response from the mast cell. And that's why medications have been so effective in stopping histamine, but at what cost? So here again, we see this idea that there's 3 phases or 3 different types of allergic responses. Each one of these types of allergic responses basically creates its own set of symptoms. And as the allergy starts to get worse and worse, that response tends to lead to other issues as well too. So here we have a picture of a mast cell. This is your typical first flight of defense. And the IgE is essentially a type of immunoglobulin that's looking for different types of allergens. That mast cell is releasing basically granulocytes that contain histamine. And histamine is what tends to cause some of our symptomatic symptoms and issues. So first, there's the immediate release of these granulocytes. And as you can see, there are other types of proteases that are also released. These help to attract more blood flow to a localized area and cause things that are basic such as sneezing, nasal discharge, itchy and runny, watery eyes, but it can also cause digestive issues as well too, cramping, and also even gas and bloating. As time goes on after the allergen is presented to the system, over minutes, basically the types of inflammatory reactions and those chemicals related to them start to change. These are more long-term inflammatory reactions that are also often talked about with chronic inflammatory diseases and conditions, such as prostaglandins and leukotrienes. There are also different types of medications that basically focus directly on trying to control this type of reaction. But in the long run, it can lead to things such as wheezing, loose stool, and constipation. It can also lead to things such as urinary retention and lack of production of mucus. And then over hours, we still produce even more immune responses that basically start up the more in-depth inflammatory response in the body. And these interleukins are typically ones that can be even measured as far as inflammation factors on a lab. They're also responsible for producing even more mucus production and to produce white blood cells that basically now spread out through the body and start to cause inflammatory reactions in other places. So overall, even though there's 3 different steps for this allergic response, it gives us a number of different places for us to start treatment and to look at it from a natural approach. We can start at the very beginning when we have just the histamine response at the surface. We can go a little bit deeper when the body is starting to have physiological changes, and we can even start to address the different specific immune responses that create issues elsewhere. When we think about this response, we have to know that even on the basic level, when we think about allergic reaction, those responses and those immune substances and chemicals that go out through the body are not just affecting our nose, like I said. Basically, it can also increase mucus secretions in other areas of the body. If that was to happen, say, in the lungs, someone might have difficulty breathing, coughing, and congestion. You might see this similar to someone who has COPD after chronic exposure to different types of toxins. You can see expansion and edema of blood vessels, which can cause either high blood pressure or low blood pressure changes. This can also affect perfusion to different arteries, veins, and even to the organ systems such as the kidney and the liver and to the brain. We can also see contraction of respiratory airways. So again, we have difficulty getting air in and out of the body as well, which can make things such as asthma more difficult. And finally, we can also see how histamine can affect the skin. And we see this with topical contact dermatitis, where essentially the skin starts to change, gets red and itchy, and inflammation is actually deposited under the skin. Over time, such things as eczema and psoriasis can start to form, and the skin starts to actually change as it kind of peels up on itself. So we have hives that start at the beginning, but essentially can kind of come and go. So when we think about the allergic reaction, we need to think about how it not only affects our current state of the allergen that we're in, but also what is it doing in the rest of the body. If we decrease our inflammatory responses overall, not only can we treat the allergic reaction, but we can help prevent chronic diseases as well. So let's take a moment to think about the way that an allergic response can lead to chronic inflammation, and whether that's in our nose and our eyes and the respiratory symptoms we like to talk about with allergies, or in other parts of the body as well too. So I want you to imagine this picture. Think of a ping pong ball, and it's getting ready to be thrown over a bunch of different sets of mouse traps. Every time that ping pong ball falls into those mousetrap, it sets off another reaction. That mousetrap sets off the one next to it and the one next to that. And that's very similar to what I call the chronic inflammation effect. One type of reaction in the body, like an allergen, basically sets the ball rolling for something else until they all go off. So something that simply seems like a runny nose can basically end up into just digestive distress, joint pain, fatigue, and also can basically lead us to becoming more susceptible to different types of things like colds and viruses. Overall, the body tends to have a hard time dealing with these types of stressors, and it finds other ways to kind of basically show us that there's something wrong with the body. It becomes a red flag. So if you think about that ping pong ball, it can only set off so many traps before they all are open and before that causes a lot of chronic inflammation issues. The way we think about chronic inflammation is it's the stress within itself, but we can also think of stress as far as a physiological issue, a biochemical and mental emotional issue, which we'll come back to the Triad of Health in a minute. But let's talk about how we deal with stress and what are some of the common signs that we see stress presenting itself within the body. So let's talk about the 7 signs of stress. And what's interesting is when we look at these 7 signs of stress, this can happen with any type of stress condition, whether it's mental, emotional, physical, and also it can show up in a lot of different ways in the body. So as you see here, the 7 signs include fatigue, irritability and mood swings, sleep issues, headaches, gastrointestinal issues, which can include not only diarrhea and constipation, but even gas and bloating, allergies, and pain. So in this lecture about allergies, what's interesting is one of the 7 signs of stress is already having allergic reactions. But a lot of these other signs are typically things that come along with our normal seasonal allergies and things we also look for to treat when we want to try to improve our allergy response. So we're getting the idea that an allergen and what we think about allergies during allergy season may not necessarily be exactly what it is, that our body's having an inflammatory response to something that might be a bigger sign of something. And essentially this also gets us thinking the question, why is it that I get allergies and someone else does it? This is where we have to start delving a little bit deeper and think outside the box. Why is it that I might be more inflamed overall? Is there something that I'm missing or something that I have too much of? So when we think of why one person gets allergens and has allergy symptoms related to another person, their not only makeup and genetic may be different, but also how they respond to things may be different. We also need to investigate for any hidden factors as well too. These hidden factors could be things such as chronic illnesses and infections that we've had with us for a long time. Certain types of issues like Epstein-Barr virus that gives us mono, herpes-based viruses like shingles, and very co-infection types of viruses and issues like Lyme disease can also be one of these things that keep our immune system active and looking for an inflammatory response the whole time. We mentioned autoimmune conditions where the body is already currently attacking healthy tissues. It may actually increase the body's ability to have inflammatory responses related to allergens. The mucous membranes may actually produce more mucus and be more of an issue, and that in itself might create more of an issue with the autoimmune condition itself. And different types of autoimmune conditions actually will have an affinity for different types of organ systems, such as lupus for the skin and also for the kidneys. Other types of conditions such as Sjogren's may also affect the skin as well too in a completely different way. But we also have to look for different types of exposures, different types of things that we've been responding to in the long run. Where did we grow up? What did we have exposure to? Were there any kind of chemicals or toxins that we need to know about? How about heavy metals and pesticides? And then finally, we also have to look at what kind of information we can get from general lab testing, but then also from some of the information we get from actually allergen testings ourselves. Do we have sensitivities to different foods that we'd like to eat commonly? Are we constantly being exposed to these different types of sensitive subjects? And also, we also have to look at how emotions can affect our health and well-being as well too. So when we look for these hidden factors, we know that there's always a condition, or sometimes it can lead to chronic diseases. And that in itself can not only affect our immune system, but how we deal with different things like allergies. So let's think about what we can do. But unfortunately, we have to take some of the old ideas and start thinking about them new. We have to think outside the box. Unfortunately, when it comes to allergy and allergy types of issues, typically the only thing that's been done is to treat the symptoms and then wait for next year. Or some people have had to go on allergy medications to basically throughout their whole year because they may be sensitive to something that they just don't know that they're responding to. So if we think outside the box and we start thinking about the whole body and just the symptoms and what those long-term results of allergies and inflammation and stress has done to the body, then maybe there's a way to think about how to outsmart the allergies. One of the ways to think of that is basically looking at thinking of things from the Triad of Health perspective. This may be a new concept to you or something you've heard over again, but it goes true for any chronic healthcare condition. We have to think about how do we affect the body and health from a structural way, as in our body, our physical body, and how we move and walk through life, our biochemical, all the mechanisms and reactions that are going on inside the body that have a lot to do with what we put in and what comes out of the body, and also the mental, emotional, or stress response. How does our body deal with things on a mental, emotional way? And how do we physically deal with our own stressors? If we think about things such as allergies in this way, we're thinking beyond the histamine response, beyond the sneezy nose and the runny eyes. What we're thinking of is how do we prevent health and wellness in the overall body on an everyday occasion, no matter what the season is. Let's dive a little deeper into this. So let's think about now a Preppan for dealing with allergies and the allergic response. Like I said, we have to think whole body, not just symptomatic relief. Now, timing can first be very key, whether someone has to deal with different types of symptoms during different seasons, or they have allergic responses throughout the whole year. Often, we'll try to have patients come in and people work on their allergy symptoms and decrease inflammation ahead of time, so they're prepared when the different types of allergens first get exposed to them, especially in springtime or in the fall with like molds. And the other thing of thinking about is you can deal with symptom relief while you're currently dealing with allergies, but then you can also, in the meantime, after those symptoms are gone, start building up your body's immune system and try to make it better so that the following time that you get exposed to these allergies, you have a better chance of not having to deal with things as harsh. We need to start to identify the root cause and issues for these. So this can be the allergens themselves, like doing things like food sensitivity testing, looking for different types of inflammation factors that have been in our plan in our health for a while, but then also types of factors such as our lifestyle factors. Do we get enough sleep? Do we get enough rest? Do we get enough food that's healthy throughout our diets? Is there something as far as like long work hours or job stress that keeps us from being able to do the things we want? Can we not get the type of exercise that we need? So overall, there's a number of different factors beyond just the health factors that we have to look at, and they have to be also planned into our overall treatment. We have to learn how to support the structure, biochemical, mental, emotional stressors of the body as well too. And as I mentioned, the Triad of Health is not something that's always reviewed when we think about allergies and stuffy noses. We have to think about the idea that clean energy in to help move toxins out. So what do we put in the body that's going to help not only decrease the inflammatory response, but also help to clear it out of the body as well? This is not only different foods and hydration like water and good fats, but it also can be different types of techniques such as chiropractic, acupuncture, and massage. And finally, we want to optimize function, not just symptom control. We can't go back to this anymore because essentially what's happening is that if we can optimize the body's ability to function normally, it will help us with no matter what condition that we're faced with. So this can include looking at how do we detox from the body, how do we get oxygen in and out, how do we get good circulation through our limbs and through our rest of our body, and essentially how do we keep going on from day in and day out. Now, one of the things we have to think about is how is the outside affecting the inside of us? And one of the things with allergies, the easiest thing to do is to also pay attention to what's going on with the temperatures outside and also the different types of things like pollen controls and air quality indexes. This information is readily available, and I often tell my patients if they're dealing with allergies and they can't change the outside world, we at least need to know what to expect for so we can make changes for that particular day. So looking at pollen indices, especially for different types of oaks and birches and trees where ragweed and mold may be more of an issue in the fall and in other seasons, We can also look at our air quality index to make sure that there's not enough pollutants outside and that it's not going to be difficult to breathe as well too. That might put more burden on our respiratory tract, but also our overall inflammation. But we can also think of things that we do inside the house as well too. We can make sure that we have different types of filters and clean air machines that basically help us circulate the air inside our house, that essentially we're able to change clothes when we come in so that we're not exposing the rest of our house, even changing our pillowcases at night if we're not showering to make sure we're not sleeping in pollens and different types of allergens. But then making sure that really if you're going to do one room in your house the best, you want to make sure that the bedroom where you're supposed to sleep and heal is actually the cleanest room that you can think of. And that overall is a way of thinking inside and outside, no matter what's going on. So another interesting way of looking for allergies and trying to identify the cause might be literally looking at it from a different perspective. And so that's why sometimes the use of thermography can give us a different perspective on allergies themselves and where we see nasal congestion and inflammation. Thermography is a digital image that essentially shows where there's heat changes in the body. So different colors are basically different temperature readings. And as we see in these pictures, you can see thermography changes and these heat pattern changes throughout different parts. So when we see sinus inflammation, the front of the nose and eyes, basically where right over the sinuses are, tends to be more inflamed and swollen. They'll show up as more red and orange and sometimes yellow, even white if they're really hot. That can often lead to issues such as nasal congestion, headaches, pressure, and some of those pressure can even radiate down towards the teeth and the upper jaw and the lower jaw as well too, or radiate over towards the ears. On the bottom, you can almost see the idea of blood and lymphatic blockage, where essentially some of that congestion and even lymphatic blockage can allow for less inflammation to be drained from the head. So we see lymph nodes that might be enlarged. We can actually kind of see where their patterns are creating inflammation within the muscle itself and creating tight muscles. And we also can look for other areas of the body where there might be different types of pain. So essentially, if there's an area such as a shoulder injury or a chronic arthritis or rotator cuff tears, that can create an inflammation pattern that might make allergies something that's more difficult to deal with. It doesn't always have to be in the head and neck again. We have to look at the whole body, so having a chance to look at inflammation from this type of view can actually give us a lot of different information. When we also think about how do we start working on the structural system, we can think about chiropractic care. Now, it'd be very interesting to think about how does the body and the physical skeleton deal with allergies and allergy types of symptoms. But here again, you see a picture of where the sinuses are actually located. And along the different cranial sutures and bones, very small movements can actually help to create more of an opening to help those sinuses to drain. If there's not proper movement of the skeletal structure and also the nervous system and spinal cord underneath, a lot of times you see different issues with organ systems not being able to get the nervous system control responses that they need, so they can't function properly. Also, the nervous system, when it's functioning properly, tends to allow us to have a more calming effect, or that parasympathetic effect that allows things to be digested, detoxed, and removed from the body, instead of always being on a sympathetic state where essentially we're running from the tiger or dealing with long-term chronic stress all the time. Chiropractic care can be one of the things that helps to address this and essentially help to also address our stress patterns in our life. Not only does structural correction mean it can help to adjust allergies, it can also function on a different level as well. Acupuncture can be one of those things that are very beneficial for allergies, whether you're currently experiencing symptoms and have short-term effect or in the long term. And there's been a number of research studies that have basically used allergy symptoms as a way of showing how acupuncture works on inflammation in the body. Chinese herbs have also been used to basically help release some of the phlegm and congestion that's also happened. They do this by essentially supporting the digestive tract in order to support the respiratory system and the immune system. All of the systems of the body, including the immune, the circulatory system, the digestive system, and eliminative functions, are basically helped with acupuncture. And that's one way we treat with acupuncture for allergies. Different points throughout the head and neck basically can kind of help promote blood flow and circulation to help relieve mucus congestion and inflammation in those different types of tissues. Also, as it helps along the neck, it can help with drainage down to the lymphatics. Digestive points also help to break up and thin out mucus as well as treat some of the mast cell inflammation and other areas of the body that was mentioned in the earlier slides that are also related to the mast cell effect and the allergy effect too. So overall, there are a number of local points and distal points that help not only to reduce the allergy response, but the stress response and inflammation for a number of key conditions. And also, it kind of gives you a great chance to do some symptomatic relief while working on the overall function of the body. One of the things that I was talked about the least with the allergies is actually being able to move the lymphatics. And the lymphatic system is basically following the circulatory system, the veins and the arteries throughout the body, and it actually picks up some of the extra fluid that's normally secreted and also helps pick up some of the waste and debris that the cells are actually dealing with. Its job is to basically bring it back to the circulatory system so it can be filtered and processed out. And what you'll notice in this picture about the lymphatic flow is that there are key areas of the body that essentially collect some of these superficial lymphatic systems, and then they go deeper to go to the lymph nodes. In order to drain the body, essentially everything goes back up towards the heart. And so lymphatic and massage can be used to kind of help promote movement towards these lymphatic key spots. And essentially, massage in itself can also help not only benefit the fluids of the body, but also blood flow to relax muscles that might also be keeping lymphatics from flowing properly. The overall relaxation of muscle tissues can kind of help bring blood flow both in and out of those muscles, including the head and the neck, to kind of help release not only giving stress reduction, but also symptomatic relief as well too. And as a bonus, the lymphatic system records a large portion of fluids that we normally release throughout the day, essentially recycling it back into the body. So when we have heavy congestion and thick phlegm, essentially what's happening is we're pulling from our own water sources. So improving lymphatic fluid is not only a way to basically recycle water in the body, but to help maintain its own fluid balance. Now, of course, when we think about making different lifestyle changes that can help with allergies, we also think about food allergies as well too, not just the environmental ones. So what comes in has to be good for us. Once we identify foods that we should probably stay away from and avoid them, or use elimination diets to slowly rotate those foods in and out, we basically have to look at adding in clean, colorful, and organic foods as much as possible. When we can't find organic foods all the time, we have to do the best we can. So we may need to look for lists like the Clean 15 or the Dirty Dozen to know which foods to eat and which foods to avoid. We also need to, like I said, identify foods that we should remove and not have into the diet. Now, on the side here on the right, you also see Dr. Tom Roselle's famous foods to avoid. So this might mean actually eliminating out some of these foods, especially during times when we have the most allergy symptoms. If we had to pick a time to be very careful with our foods, it has to be going into an allergy season and during the times. So if someone drinks a lot of coffee, sugar, tea, or dairy, essentially this might be a good time to eliminate them or use them to a very small degree in order to decrease inflammation and phlegm production. The other things we have to do is watch out for foods in the same family. So if someone has issue with, say, broccoli, even though it's a healthy food, they have to think about the fact that the other cruciferous vegetables such as cauliflower and Brussels sprouts have some of the same chemical components and makeup. So we have to be able to make sure that we don't eat foods that are in the same family all the time, or we rotate them so we don't develop an issue. We have to find foods to add in if we're going to take foods to come out. So if someone's going to be gluten-free, we have to find gluten-free alternatives and different types of variety. Foods that are high in antioxidants, the big colorful plants, provide the protective power that plants use to also defend themselves, just like they would use to help oxidative stress within our body. It helps to not only make us better overall for allergies, but essentially it also helps out with chronic diseases as well. Special diets may be necessary at certain times during the year, or even to help to modify. So a lot of times we end up giving diet diaries to see what people are actually doing when they come in to seek our help. And that way we can kind of help them combine up with different plans to what to eat for breakfast, lunch, and dinner, and different snacks. Overall, that's giving us information of what they're currently eating, not to necessarily scold them for what they should be eating. Again, these types of foods are kind of best to be avoided at all times, but if someone's going to particularly avoid them during their allergy season, it's going to make a big impact. One of the basics that you see as well too is we have to stay hydrated. Water not only helps to flush these toxins out, but it also decreases the inflammation response. Essentially, you're cooling down the body by giving it what it needs. So making sure we're adequately hydrated, looking at half your body weight in ounces of water per day, and if someone's not drinking water, they need to slowly increase. They may even need to increase electrolytes or using sea salts to help them pull the fluids into the tissues instead of just urinating them out. But we can also use fluids that we think of as such as essential fatty acids like omega-3 fish oils, flaxseed oil, nuts, avocados to essentially help to lubricate the body as well too. A lot of these oils can also be found in different types of topical solutions that can be used to help with dry, irritated skin that's inflamed as well from allergies. And creams and lotions can also be used to help out when there's more inflammation such as eczema, psoriasis, and even poison oak. Basically, what we have to think about when we have these essential fluids is that we need to hydrate in order to flush out the toxins of the body. So if you're going to hydrate, this is also the time to do it. There are a number of allergies or a number of supplements that you can use during allergy season. And a lot of these do basic things like boost the immune system, but they're also protecting the body from oxidative stress, the stuff that happens when we normally have normal function, but essentially it produces not only energy, but it also can produce oxidation. The vitamins such as A, C, E, and selenium produce not only good immune boosting benefits, but also can help out with essentially antioxidant stress. Probiotics help out with the digestive tract and immune support. As more and more information comes out about the importance of balancing the microbiotica of the body, we know that we have to put in a variety of probiotics and also feed them with the correct information and the correct types of non-medicative supplement needs. And essentially, we also have to give adrenal support. Our chronic stressors that we deal with, whether it's allergies or not, we have to deal with the fact that the adrenals have to not only make our sex hormones and help with our fluid metabolisms, but are also involved with our fight-flight systems. So a lot of times adaptogens need to be added in at this time. And we can also support the body's way to detox, and that requires cofactors such as the antioxidants listed above, but other things such as additional vitamin C and B vitamins as well. There are some immune underdog heavy hitters that we think about a lot, and during the time of COVID, basically we've heard a lot about these. Vitamin D, zinc, vitamin C, quercetin, and NAC all have abilities to boost the immune system and get out phlegm production or thin it so that it doesn't end up in the mucous membranes and in the nasal cavities and in the lungs. So these are some of the real basic things that we can do to boost our immune system. Again, you should talk with your healthcare providers about what might be best for you and also what might work for other healthcare conditions. Often these are used together in combinations because synergy and getting the best out of all worlds, whether it's chiropractic, massage, acupuncture, and nutrition, are basically going to create the best functioning environment for you. We can also look at the way that plants and herbal medicine can affect allergies as well too. And here are listed 3 of the main herbs that you often see in combination together. Like I said, synergy works the best, or you might see them separately. One of my absolute favorite is stinging nettles. So if you think that allergies give you a sting, so don't these. They basically help decrease histamine responses and also can help with mold and fungus. Contains high levels of quercetins, vitamin C, and different types of minerals. Often I like to have people use this in a tincture type of basis where they add a little bit to water, but I've seen it used also in tea and encapsulated form and even made into soups for this during the spring. Butterbur is another way of using an herb to basically work on leukotrienes, which is another intermediary inflammatory chemical, and it helps prevent mucous membrane congestion and swelling, working similar to the Zyrtex, Allegra's, and Singulair medications. Euphrasia in itself, when it sounds like eye bright, is because it has an ability to relieve dry, itchy eyes and swollen mucous membranes. It's an astringent and anti-inflammatory. So these 3 herbs are kind of like the green herbal ninjas of the world that are essentially out there to help out with allergy control. If we think outside the box, we also want to think about other types of herbs such as aloe to help out with digestive tract issues, or even topical. We may want to think about licorice, which happens to work as a adaptogen, but also kind of helps boost the immune system, and many other herbs that might be used in combinations. Anytime we do think about plant use, though, we do have to think about a couple of things around it as well, too, because not all plants are going to be good at all times. So here's a perfect example of a couple of plants we have to look out during allergy season. These are medicinal herbs that are commonly used, but they're also found in the ragweed family. Echinacea is often used for different types of immune support as an immunomodulator. Golden seal, which actually helps out most of the time with lymphatic swelling and large lymph nodes, can also be used as antimicrobial. Wormwood has been used often due to its bitter properties to help remove from parasites. Milk thistle can be used as a common liver support, and chamomile is often used as a tea to help with calming. Since they're all part of the ragweed family, if someone has ragweed issues or is in a heightened allergic response, it may not be the best herbs for them to use at this time. So working with a healthcare professional may actually have a chance to find a different type of herb or plant that might be able to support the system. I mentioned licorice before as an adaptogen, but also licorice in itself, when taken in high levels, can also increase the blood pressure. It ends up secreting potassium and increasing sodium, so it pulls more water into the circulatory system. So this can be very difficult if you have patients who have unstable hypertension. So licorice in itself may not be able to be used by itself, but it might have to be used in combination. So what have we learned about allergies? We learned basically that we have to think outside the box, and in order to do that, we can come up with a plan that works best for not only allergies during a certain season, but year-round, and how it affects the rest of our stress and basically our inflammation in the body. By addressing stress and inflammation, we can address allergies in return. What we know about allergies can help you. What you are feeling and observing also helps us kind of come up with a game plan as well to move forward. You know your body better than anyone else, so essentially your practitioner is relying on your information as well too. So you have to be an active component, not only making any changes or additions lifestyle-wise. In order to do that, then we can start to move forward. We have to learn how to identify the cause, not just the specific allergens. We have to be able to come up with individualized treatments that works for the person, not just for the whole society. And that might involve multi-level approaches that work on the entire body, using things like chiropractic, nutrition, acupuncture, and massage therapy, and then with the support of different supplements if needed. We have to look at lifestyle changes too to make sure that we're able to boost the immune system through proper rest and digestion. We're able to hydrate with good fluids, and we're also able to help move the muscles through lymphatic massage and also exercise. All of these things are important, and none of them should be left out. So coming up with a key game plan has to depend on how you're able to do this within your current lifestyle, or do we have to make changes? Prevention really starts earlier on, but then in order to treat chronic issues, we have to think about how do we work not only on the current set of symptoms, but also on our wellness care. And that can happen in a number of different steps and stages. We can think of preventative health as recognizing issues before they happen in order to minimize issues later on. And when we do that, we start to kind of think of where our health is currently and what our overall goals are. Are we moving enough? Are we sleeping enough? Are we ready to actually make the commitment to make these long-term changes? And no one said it was going to be easy. Preventative health is the first stage of moving forward in this long-term marathon of health and wellness. We can think about things that address our acute care, our symptom control. How do we get through the moment? We have to be able to be comfortable and work and function. So we not only have to take into consideration the rest of the body, but symptom control also helps us feel better at the moment. However, acute care treatments don't always last, and they can also come back year and year over and over again, or in the case of allergies, season after season. And this can actually lead to additional issues later on. We can think about maintenance care as the next step. What do we do in the time in between allergy symptoms? This is the chance to take care of the rest of the body, to help identify and treat those causes, to really look and kind of clean up the system and kind of look at what we want to do with our overall health. What is being healthy to us? Does it mean being joint and pain free? Does it mean being able to sleep? Does it mean being able to exercise and be with our loved ones throughout the day? If those are your goals, you basically have to make sure you're putting some kind of maintenance care in there. We take a lot of good care of our car, we take care of our homes, but a lot of times we have a difficulty taking care of ourselves. Maintenance care is something that happens in a longer period of time. And finally, we have to think of things in terms of wellness care. How does health and wellness continue into the future? What does that mean to us, and what are our ultimate goals? Is it just to prevent us from being sick later on or developing some kind of chronic disease? Or do we want to be educators ourselves so we can help spread the news on different things that we can do? Overall, a lot of these steps require time and both education and communication between practitioners. But in order to know that health is a long-term goal and not a sprint, we have to increase communication between everyone and then also understand what everyone's goals are. So one of the great things is now that you've learned a little bit about how to deal with allergies and think outside the box, we have a chance for you to get actively involved as well too, to start that communication cycle. And essentially how we can do that is by offering you a special at the Roselle Center for Healing to meet with myself, as well as some of the other practitioners who are involved in your healing process. This special is only good till May 31st, but for $125, which is a normal value of $420, you can basically come in and do a new patient acupuncture examination, and we'll sit down and go over exactly what your goals are, from dealing with allergies to other types of issues, and come up with a great treatment plan that's specific for you. Plus, they're also going to test for the top 10 allergens, different types of foods like corn, dairy, gluten, just to say the least. And finally, they're also going to look at 4 different areas of interest, essentially around the head, looking at the sinuses to see if there's inflammation that shows up on thermography scans. So basically, you're able to come in for $125 and get not only your acupuncture examination consultation, but also start your journey to see if there are allergens that you don't know that you're exposed to, and then also see where there might be different areas of inflammation and chronic congestion as well. This is a great offer, and I expect everyone who has listened to this lecture to take advice and basically either pass this on to someone else or to also come in for themselves. Since we're in the middle of allergy season now, it makes the most sense to start with the acute care phase and then start identifying issues in the long term. If you're really serious about making changes and in your life that can be guided with our help, then this is a great offer for you. So you can call our office at 703-698-7117 or go to our website as rosellecare.com and sign up. I hopefully you enjoyed this educational webinar and at least learned a few things here and there about how allergies are not just in your head. Hopefully you'll join us for another educational moment as well too, and we look forward to seeing you at the Roselle Center for Healing. Thank you very much.